Did you know that according to the Centers for Disease Control and Prevention, osteoarthritis, affecting more than 32.5 million adults in the United States, osteoarthritis is the most common form of arthritis, affecting millions of people worldwide. It happens when the protective cartilage that cushions the ends of the bones wears down over time. Although osteoarthritis can damage any joint, the condition most commonly affects joints in the hands, knees, hips, and spine. It's just a matter of wear and tear on your joints. You use them too much, they get worn out, and that's osteoarthritis. But guess what? Our understanding has come a long way since then, and the simple answer is no. Osteoarthritis isn't just about the cartilage wearing down from use. That cartilage, that smooth layer that acts like a cushion protecting the ends of our bones in a joint, is definitely involved, but the cause is much more complex. So, stick around, because in this video, I'm going to explain what osteoarthritis truly is, and, more importantly, what you can do to help prevent it and ease the pain if you're already living with it. So, let's have a good chat about osteoarthritis. Osteoarthritis is indeed a condition that affects the cartilage in our joints, that crucial protective layer between our bones. But the old idea that it's simply caused by putting too much weight on a joint, using it too much, moving it too much, or even exercising it too much, well, that's not the full picture. We used to think that excessive weight was a primary culprit, especially because the joints most commonly affected are the weight-bearing ones, like our knees and hips. It seemed logical, right? More weight, more stress, more wear and tear. However, the real cause of osteoarthritis is far more nuanced. It's not just about overuse. People can develop osteoarthritis in virtually any joint in their body, even in places that don't bear a lot of weight, like our shoulders, hands, fingers, and even our neck. The current understanding points to a slow-burning, low-grade chronic inflammation within the joint as the primary driver. Now, when we talk about inflammation, we're talking about the body's immune system, sending cells and producing various substances. In the case of osteoarthritis, these inflammatory substances, unfortunately, start to break down the cartilage over time. So, the big question then becomes, what triggers this chronic inflammation in the first place? And does taking anti-inflammatory medications actually solve the problem? Well, the truth is, scientists are still working to fully unravel the exact causes of this chronic inflammation. We know there are definitely genetic factors involved. Some people are simply more predisposed to developing osteoarthritis than others. But there's also a lot of exciting research happening around the role of fat tissue in our bodies, also known as adipose tissue. It turns out that fat tissue isn't just a passive storage depot for energy. It's actually an active endocrine organ, meaning it produces and releases various signaling molecules called adipokines. The very first adipokine, leptin, was discovered back in 1994. Since then, scientists have identified over 100 different types of these adipokines. Now let's shift gears and talk about the second really important factor when it comes to osteoarthritis: movement. You've probably heard me say this many times before, and for good reason. Motion is lotion. Yes, actively moving your joints, even putting gentle weight on them, and using the cartilage is actually really beneficial for the health of that cartilage. I often use the analogy of honey. If you have crystallized honey that's cold, it's thick and sticky, right? It doesn't flow very well. But if you stir it up and warm it a little bit, it becomes much more fluid and clear. That's similar to what happens with the synovial fluid in our joints. The more we move our joints, the more synovial fluid is produced. This synovial fluid is what brings essential nutrients to the cartilage. When you put weight on the joint and move it, the cartilage acts a bit like a sponge, absorbing these vital nutrients from the synovial fluid. This nourishment helps to keep the cartilage healthy and functioning properly. Think about astronauts who go to space. In the absence of gravity, they don't put weight on their joints in the same way we do here on Earth. Studies have shown that their joints tend to have less fluid, and their cartilage can even become thinner. On the other hand, people who regularly participate in sports and engage in a lot of physical activity often have thicker cartilage in the joints they use the most. This clearly demonstrates that moving our joints is actually good for maintaining healthy cartilage. I have several other videos on my channel that show specific exercises for osteoarthritis of the hips and knees, as well as the benefits of activities like dancing and even safely navigating stairs. I also have videos focusing on exercises for osteoporosis, which often coexists with osteoarthritis. I encourage you to check those out if you're interested in learning more about movement strategies. The third really important thing to understand about osteoarthritis is that the amount of pain a person feels from a joint with osteoarthritis doesn't always directly correlate with the amount of actual damage there is in the joint. It's quite possible for someone to have relatively mild osteoarthritis on an X-ray and yet experience a significant amount of pain. Conversely, another person might have what looks like very severe osteoarthritis on imaging and yet report very little or even no pain at all. Let me give you a couple of examples to illustrate this point. Imagine we're looking at an X-ray of someone's neck. The X-ray might show only minimal signs of osteoarthritis, perhaps just a few small osteophytes, bone spurs. However, this person might be experiencing a lot of neck pain and stiffness. Why is this? Well, the pain might not be solely coming from the minor osteoarthritis in the joint itself. It could be originating from other structures around the bones, such as tight muscles and myofascial trigger points. But it's also possible that even the small amount of pain X and how coming from the osteoarthritis is being amplified within their nervous system. This phenomenon is known as central sensitization. In central sensitization, the pain processing system in the spinal cord and brain becomes overactive, so even normal or mildly painful signals are perceived as much more intense. Not only that, but the body's natural pain-inhibiting mechanisms might also be less effective in these individuals. Did you know that we have our own internal pharmacy? Our brain can actually suppress pain by releasing powerful natural opioids like endorphins, enkephalins, and dynorphins. However, some people with chronic pain conditions, including osteoarthritis, may have lost some of this natural ability to dampen down pain signals. By all accounts, this was terrible, advanced osteoarthritis of the neck. But here's the astonishing part. This person had never experienced any neck pain in his entire life, not even for a single day. So what does this tell us? It highlights the fact that the structural changes, seen on an X-ray, don't always directly equate to the level of pain a person experiences. Practical steps to take if you have osteoarthritis pain. So, if you're experiencing pain and have been told it's due to osteoarthritis, what are some practical things you can do to help yourself? First and foremost, I want you to seriously think about weight loss if you are overweight or obese. Even losing a modest amount of weight, just a few pounds or kilograms, can significantly reduce the number of those pro-inflammatory adipokines your body produces. This, in turn, may help to slow down the progression of your osteoarthritis and potentially reduce your pain levels. Second, start exercising. As we've discussed, movement is crucial for joint health. The more you move your joints in a safe and appropriate way, the better the nutrition to the cartilage. I highly recommend water exercises if you have access to a pool, lake, or beach. The buoyancy of the water allows you to move in all directions with less impact on your joints, while still providing resistance for strength training and cardiovascular benefits. Plus, the warmth of the water can be very relaxing. But if you don't have access to water, don't worry. Just start moving in any way that feels comfortable for you. Dancing, playing low-impact sports, walking, biking, even just doing gentle range of motion exercises at home. Remember, motion is lotion. Third, it's really important to address potential central sensitization. There are many mind-body therapies that can help to retrain your pain system and turn down the volume on your pain perception. These might include things like mindfulness-based stress reduction, MBSR, yoga, Tai Chi, cognitive behavioral therapy, CBT, and other techniques. I have another video where I talk more about these types of therapies, so I encourage you to check that out if this resonates with you. And finally, focus on eating a healthy, anti-inflammatory diet. This means incorporating more foods like fatty fish, rich in omega-3 fatty acids, using olive oil as your primary cooking oil, and enjoying plenty of colorful fruits and vegetables. It also means reducing your intake of processed foods, refined white flour products, and sugary drinks and snacks, as these can contribute to inflammation in the body. I have a dedicated video with more details about anti-inflammatory diets if you'd like to learn more specific dietary recommendations. I also have separate videos about the benefits of omega-3 fatty acids and the potential anti-inflammatory properties of turmeric, which is a wonderful spice to incorporate into dishes like Indian curries, soups, and even with chicken and rice. Well, there should be a button around here somewhere for you to easily share this video with anyone you know who is living with osteoarthritis. Please feel free to send it to them. Hopefully, they'll find this information helpful. Thank you so much for watching today. I hope this has given you a better understanding of what osteoarthritis really is, and, more importantly, what you can do to manage it. Take good care, and I'll see you in the next video. Goodbye for now.